Good evening, everyone. It's such a pleasure to see so many friends in the room and also some new faces. But thank you for joining us in person. It's great to have you all here. And a big thank you to Sweli and the Quit Like Sweden team for organising such a fabulous event in such a fabulous venue. It's really beautiful. So thank you very, very much. So before we start with the panel, I'm going to briefly walk you through the speaker biographies. So we have Dr. Marewa Glover, who is the principal author of the report that we've just launched. So she is director of the Independent Centre of Research Excellence of the Indigenous Sovereignty and Smoking, based in Auckland, New Zealand. And she was also a former professor of public health at the Massey University and a former chair of End Smoking New Zealand. We then have Dr. Colin Mendelsohn of Australia, who has worked as a clinician and academic in smoking cessation and harm reduction for 40 years. He was also a conjoint associate professor in the School of Public Health in the University of New South Wales in Sydney, and he was a member of the expert advisory group that developed the Royal Australian College of General Practitioners National Smoking Cessation Guidelines. And he also authored a book, Stop Smoking, Start Vaping. And then we have Dr. Anders Milton of Sweden, who is a physician with extensive experience in public service, and he works as a healthcare consultant, and also he is the current chair of the Snus Commission. And then we have Dr. Delon Human of South Africa and France, who is the leader of the Smoke-Free Sweden movement, and is a published author, international speaker, and healthcare consultant. And from 1997 to 2005, he served as Secretary General of the World Medical Association. Okay, so now I would like to call up our speakers to the stage, please. So if we could have Marewa and also Colin Mendelsohn. And just a big congratulations to our speakers and to Delon Diego, who authored this wonderful report, which you should have in your hands. There's also an online version of the report at smokefreesweden.org at the resources page. So we will be sharing that link to the online version over the next few weeks at the Smoke Free Sweden social media channels. Right, so my first question is to Marewa. And I'm going to ask you a question about accelerating science and research. So one of the recommendations to other countries within the report includes accelerating localized and customized tobacco harm reduction research. For countries who are falling much further behind New Zealand and Sweden in terms of their smoking rates, where do you recommend they start when it comes to research?
Thank you, Jessica. The example of New Zealand is that, well, obviously researchers, myself, Murray, started it, and others and colleagues. We researched vaping. We researched what consumers thought, their perspectives, and what they had to say. And that was important, randomised controlled trials. So you have all sorts of different research going on. When the government decided to monitor vaping prevalence in the national survey, that was also important. I think that it's very difficult for governments and to advocate for governments to make goals to change behaviour when they don't even measure or monitor it. So I think that monitoring and evaluation is very important. Evaluating programs designed to help people stop smoking. There was quite a few of those that occurred in New Zealand, and they showed that the smoking cessation services weren't doing that well. Our free quit line, after many years, was evaluated, and they were struggling to get to meet their contractual obligation of helping 100,000 people a year. So they lost their contract, and it was moved. The government restructured the whole smoking cessation sector, and this is on the basis of evaluations. What do you do if you haven't got any researchers? Well, you need you need the people in America and Canada, Australia, well, maybe not Australia. If it's Colin, that's okay, or Carol, but you need to have them partner with, low middle income countries, for example. Very, very little research is done there for them. So,
So I have one more question about health outcomes in New Zealand. So can you please summarise the effect that the introduction of vaping has had on the public health outcomes in New Zealand versus other developed countries?
I think that what was always said, what I always heard from Richard Peto and many others, is that there will be a bit of a lag. If everybody stops smoking, there's going to be a lag before you see the, lung cancer, the cardiovascular disease, etc., come down. That's because all of the people, all of the people that currently smoke, and many who have smoked for many, many decades, it's not that there won't be any benefit for them. I mean, many people who vape here know, they smoke for a long time and they've quit, they've switched to vaping, and they do experience improvements in health. But in terms of those figures, there will be a lag. But, we're talking about at least 10 years now. The benefits are that for New Zealand, less people are even starting to smoke. So that's what Richard Peto said. The earlier you start, the longer you smoke, the more you smoke, the greater the risk. Less people in New Zealand are even starting to smoke. That's number one. Two, they're stopping earlier. So we have many people who are stopping before they get to 30. They're not smoking as long, and they're not smoking as much. So vaping, even if people smoke and vape for a while, while they're transitioning, they cut down on their consumption. So we should be starting to see some effects coming through in the stats, I would say, in the next 10 years, definitely. I also think that there's a well-being, an improved well-being. All of the people who smoked in New Zealand were stigmatised, were made fools of, were ridiculed in mass media campaigns, and their self-worth, their feeling, their well-being has improved a lot, especially if they've switched to vaping. And many others, there's still some people who are sceptical, but there are many people, as my own research has shown, who are having a go. Unfortunately, the misinformation, the negative lies about nicotine are unfortunately putting a lot of people off, but that's something we're all dealing with as a challenge.
Thank you, Marewa. Thank you for explaining that so concisely and clearly. If we do have any questions from anyone, please can you save these for a brief Q&A session at the end of the panel, and we'll take questions then. I just want to introduce our next speaker, Dr. Anders Milton. Hi, Anders, can you hear me?
Yes, I can hear you. Thank you.
And we can hear you perfectly. So I'm going to keep the question very open. Can you please provide your comments on the report?
Yes, let me start by saying that I'm sorry I couldn't be in Warsaw. I would have liked it a lot, but for personal reasons, I could not be there. Anyway, I've been working with I'm a doctor by training, and I worked with harm reduction when it comes to drugs, for example. And I think it's important that we can save the people that 1.2 billion people that smoke. If we can save them so they don't die prematurely, I think we made something. And I think it's important to see that New Zealand doesn't have the same way out of smoking as Sweden has. Sweden has snus that we had for 200 years. And now in the last 70 something years is made in such a way that it doesn't cause cancer. And you don't get cancer from nicotine, but you get it from the tar. You get it from smoking cigarettes, but you don't get nicotine. Nicotine doesn't cause cancer. And many doctors do not realize that and do not know the difference between nicotine and the tar. And I think that's a shame because, and I think that with all respect, the World Health Organization and the European Union are wrong. and they don't accept the fact that nicotine gives you a kick. I don't smoke. I don't use snus either, but it's very important to see that when you need it, you get a kick. It's like coffee, you know. And had coffee had some problems with it, you know, we would have forbidden coffee, but we don't.
Thank you, Anders. You have a lot of experience working in public health over your career. So how can we as advocates better inform politicians about the facts regarding the safer alternatives so that they will actually listen to the evidence? What do you think has been a proven effective strategy?
I think that it's important to be truthful. You know, that you shouldn't use arguments that are not based in science. You know, for the Snus Commission, we only use official statistics. We don't use anything homemade, anything whatever. And it means that we use the European Union statistics or we use the World Health Organization statistics. And we see that we have the lowest incidence of lung cancer in the European Union. Not because people don't use nicotine. I mean, 70% of the male population in Sweden uses snus every day, and 5.6% smoke. So we use about the same amount of nicotine as in the rest of Europe. The difference is that we use it not in a smoked form, but in snus, and it doesn't cause cancer. Simple as that. You can live with snus, but you die from the cigarettes. I don't hear you. I don't hear you.
That we may have at the end.
Now I hear.
Yeah, so if you wouldn't mind holding on, thank you very much, Anders. We may have some questions for you in a few minutes. Thank you.
No problem.
Now we'll move on to Colin from Australia. So I have a question regarding the New Zealand approach versus the Australian approach. So as an Australian physician with extensive experience in smoking cessation and tobacco treatment in Australia, helping smokers to quit cigarettes, can you briefly tell us about the regulatory differences between Australia and New Zealand?
Yes, thank you. I'd love to. Look, I must say it's lovely to be amongst friends. Where I come from, there's enormous hostility to tobacco harm reduction, and it's nice to see people who get what I'm talking about, and it's not a hostile environment, which is what I'm used to. Because in Australia we have a very restrictive policy on vaping, to the point that it really is a form of prohibition. Nicotine liquid is regulated as a medicine, not a consumer product or a tobacco product. And that means that you need to be at least 18 to vape. You need to get a prescription from a registered doctor to be allowed to vape, and then you need to buy your prescription from a pharmacy. So you can't sell products from convenience stores, retail outlets, tobacconists legally. You have to buy these products from pharmacies. Personal importation of products is banned. Vapers used to bring products in from New Zealand in particular. They can't do that anymore unless you've got a licence to bring products in for sale in pharmacies. And then you need a special licence for that purpose. In Australia, there are only 3 flavours allowed: nicotine, tobacco, menthol and mint. And there's a very limited range of devices available. So for vapers in Australia, it's very challenging, and the products generally are unappealing, inaccessible, and they're becoming increasingly unaffordable.
So in reality then, how is the model really working?
Well, yes. Well, the model is not working in terms of the legal options available. So the vast majority of users are in fact resorting to the black market. The current model that's legal is so hard to access and so unappealing that the products are unappealing that people are buying illegal products through the black market. Now, that's a black market controlled by the same criminal gangs that import illicit tobacco into Australia. They have a major network that's well run, and they import these products and sell them through retail outlets, social media and on the internet. And these organisations are criminal groups and bikie gangs that are engaged in turf wars to control market share. So what that means is we're having enormous numbers of tobacco and vape shops firebombed. We're having homicides. We're having extortion of tobacco and vape shops to control their share of the market. So it's a totally unacceptable situation. We've got now this... Vaping is the second biggest illicit black market for drugs in Australia. And we created that. Cannabis is number one, vaping is now number two. So yes, there are ways of accessing products, but these are products that are unregulated, they're high in nicotine, they're poorly labelled, and we really can do better than that.
I have a question regarding youth vaping. As we know, it's a key concern for many. What are your thoughts on the effectiveness of Australia's stringent vaping regulation in actually reducing youth vaping, considering the data showing there's high underage access rates?
Yeah, so one of the purposes of our strict regulations was to restrict vaping for access for young people, but of course these strict regulations have been counterproductive. So what's happening is that because we make vaping so difficult to access, we've created a thriving black market that, of course, doesn't respect age regulations. And the black market sells freely to young people. So young people can access these products more easily than they otherwise would. So Australia has one of the highest youth vaping rates in the world, certainly in Western countries, as a result. 1 in 6 12 to 17-year-olds have vaped in the last month. The regular vaping rate is much less than that, but the problem with that is not so much that it's harming the youth, but that it's driving an anti-vaping message. So policies driven by moral panic about youth vaping. The little darlings are all vaping, we're told, and mothers and school teachers are becoming very distressed about a variety of imagined problems that are being attributed to vaping, and that's undermining the message about vaping being an effective smoking cessation tool, and I think that's the biggest problem it's causing.
And that leads me perfectly on to my last question regarding government communication. So how has the Department of Health in Australia communicated the risks and the benefits of vaping compared to New Zealand's approach?
Yeah, well, the answer is that they've been very good at communicating the risks. So they see vaping, our government sees vaping as a public health menace that needs to be managed. In fact, the Minister for Health yesterday stated in a radio interview that his goal is to see the vaping industry eliminated from Australia. So his concern, of course, is youth vaping. That's his excuse. He talks very little about the benefits. Vaping is, as we all know, it's a tobacco industry ploy to addict a new generation to nicotine. And, of course, then they're all going on to smoking and being brain damaged. And this is the sort of information he's constantly informing Australians about. And if you say it often enough, people believe in it. So, yes, we're getting negative messages from the government, from our health associations, our medical associations and health charities. And unfortunately, they're all in group step. And they're all saying the same things. And they're all pushing legislation to minimise risk and basically ignoring the millions of Australians who smoke, who are at risk of death and serious illness. Yeah. So it's a very disturbing situation. But in spite of that, we still have very high vaping rates in Australia. We don't have nicotine pouches. We have a vaping rate of 7% of the adult population. 1.7 million people are getting these products illegally. And it's still the most popular quitting method in Australia, even though it's essentially banned and the most effective. So, the government thinks it'll be able to control vaping. It'll just increase interceptions at the border, increase policing. It'll pass legislation, but we all know that that's not going to make any difference to long-term use when the product is in such high demand.
So regarding the smoking rates in Australia then, what impact has the government had in terms of their communication approach on the smoking rates in Australia?
Yes, what's interesting is we just this week introduced a new campaign to educate people about vaping, about how terrible it is. And we've got this mass media campaign that's just started with television ads and other interventions. What's interesting is that over the last 12 years, we haven't had a mass media campaign for smoking. So we've forgotten about smoking. But now suddenly we're spending a lot of money educating people about the terrible dangers of vaping. I mean, it's all out of perspective. Australia's smoking rates are slowly falling. They could fall a lot faster. Certainly they could have fallen as fast as New Zealand. New Zealand's overtaken Australia. Australia's rates are falling, and a lot of that is due to the illegal vaping. But they could be a lot faster if vaping was encouraged and supported.
Thank you very much, Colin. Fantastic. So before we move on to any questions, Delon, would you like to summarise any points?
Thank you, Jessica. Just firstly, it's such a privilege to see all of us together as a room of multi-stakeholders. I see consumer leaders, I see health professionals, manufacturers, police hosts, and it's a privilege to be together, firstly because we all believe and subscribe to tobacco control, but I think all of us also have seen the light in what harm reduction can do if that is joined to tobacco control. So perhaps just 3 words as you read this very important report. Congratulations, Marewa, and the rest of the co-authors. But firstly, the word is replication. Number 2, experiment. And number 3, speed. So just firstly on replication. This report shows that what the Swedes did over many decades can in fact be replicated in other countries. To do just that. Both were staunch tobacco control experts as countries, but the Swedes embraced harm reduction some decades ago by making sure that non-combustibles were made affordable and accessible and acceptable to Swedish consumers. It's so simple. And New Zealand, if you look at their story and if you see the graph that Marewa showed us, same story. The government first banned it, and then they turned around and they said, well, why not? Let's regulate it and see what happens. You saw what happens. So the replication is possible from Sweden to New Zealand, but our goal must be to try and reach the 194 member states of WHO so that they can all look at this model and see, is it replicable in their country? The second word is experiment. If you think about it, Sweden and now New Zealand, and Colin, Australia, are some of the largest naturalistic experiments live, underway in their countries, where different governments have tried different regulatory approaches, and you can see in the smoking prevalence and then in the health outcomes how the different policies have worked out in the indicators that matter. And we've been in tobacco control, many of us, for many years. Ultimately, it's always to prevent and control smoking-related death, premature death, disability and disease. Look at the stats of New Zealand, and that's what we try to do in this report. Look at the disability-adjusted life years and how much fewer years are lost in New Zealand because the government has made the right policy choices. Likewise in Sweden. Why would Sweden have 41% less cancers than the rest of the EU? And you remember Anders mentioned total nicotine use in Sweden is equivalent to the rest of the average EU countries, but they have much better health outcomes and a much lower smoking prevalence. So simple. So this kind of naturalistic experiment is extremely important. I see David Sweeney in the room, and David would say Japan should be added to the list. Where in the world has a country over the last 5 years managed to convert 50% of their combustible cigarette smokers to a non-combustible form of nicotine delivery? So these large naturalistic experiments need to be deeply studied. And as Clive Bates would always say, the sky should be darkened with aeroplanes of epidemiologists and public health experts coming to see what has happened in these countries. But then the last word is speed, and to me that's the most important. We can have these conferences for the next 10 years, but as long as we have the conferences and we don't have the other 194 member states come on board with harm reduction, we will lose lives. So as we're speaking, the clock is ticking, and lives are being unnecessarily lost. And if you now look at what happened in New Zealand, and specifically the graph of how smoking prevalence suddenly dipped when the government approved risk proportionate regulation, taxation, labeling, and communication. This is obviously the formula that should be followed. And that's what I hope this report can do through Marewa, Colin, and the other co-authors of this, is just to connect the dots and to make sure that there is renewed research, renewed interest, and awareness of quit like Sweden, quit like New Zealand. And maybe just the last word on the word quit. So we as physicians, we always spoke about quit or die to our patients, which is criminal actually, if you think about it. But what has been expanded in the quit like Sweden, quit like New Zealand, is the definition of quit. We've always said quitting means no cigarettes for 6 months. But what's happened in these countries? There's been a switch. Consumers have switched from combustible, dangerous stuff to non-combustible, smoke-free nicotine alternatives. That's the key. That's absolutely the key. So let's please, all of us, become advocates for quit like Sweden, quit like New Zealand. And long may this last. Thank you, Marewa.
Look, could I just say how proud I am to come from a country that's volunteered to be the placebo arm of this natural experiment. Somebody had to do it, and I hope it shows the way forward. Thank you.
Thank you, Colin. And thank you, Delon, for that fantastic summary. We do have 5 minutes for any questions. You have one.
Oh, thank you. Hi. Sorry, my name is Maria. I'm on the panel at the end, but I have a question to ask because we in Canada have had the highest drop in smoking rates when vaping became legal in our country, and then we're now becoming Australia. So we're in the middle of both of you, but my question is, how do we switch over the negative stigmatization? We have governments, unlike New Zealand, where they're saying all these awful things. People in power are saying that vaping is worse than smoking. Can we flip that? Because in New Zealand, part of that positive reinforcement, but how does a government turn around and then say, oh, we made a mistake? Because they have a lot to lose, and this is public health. And this is what worries me, is that are we too far gone for the people that haven't switched?
Who wants to take that one?
I have to say, we've been working on this nicotine misinformation for years. I remember writing a paper with a panel about 15 years ago, outlining all the issues about how harmless nicotine is. And really, we're still in the same place we were back then. So it seems to be such an ingrained issue, and it's being maintained by people with an interest to do that. So I think it's very hard. I can't see any simple way around it. I mean, there are the pro-vaping forces are not well funded, and that's one of the struggles that we have. And consumer organisations like yours and so many organisations don't have the money. And to challenge the dominant narrative, our health minister says repeatedly how harmful nicotine is and the danger it's causing. Over and over again, he gets national airplay. It's repeated in the media. I'm not sure how you compete with that.
Thank you, Colin. For me, being Indigenous, and Canada has many First Nations, and Australia has Aboriginal people, and the disproportionately high smoking rates. This was, New Zealand, Australia, America, Canada, Greenland, under the control of Denmark, everywhere like that. The disproportionately high smoking rates for Indigenous people exists. Why? In Australia, the Indigenous people make up about 2%. In New Zealand, we just had some stats come out from a census, we're up to 17%. I think that there are so many health issues, so many political issues for Indigenous groups in these countries that, and we've tried, Colin and I tried in Australia to, to talk to Indigenous leaders and conferences. And whilst Indigenous people, Aboriginal people were vaping and quietly vaping, there's so many more, critical issues, high suicide rates, and I could go on and on. So it's very difficult when, if only they could, have a voice and start saying, like New Zealand, what worked for them, we want it as well. They do have power to say, no, this is another inequity. You're now denying us this life-saving opportunity, and that is very, very wrong. And but it's a wide problem. All of the other health issues as well, and our European counterparts, some of the others, not you, Colin, they're deliberately going in and lying to the Indigenous people, to the Aboriginal people about vaping. They will pull their funding if they say anything pro-vaping. So, there's those kinds of controls that are keeping them quiet. I just know that some of them are quietly vaping anyway, but yeah, it's a big problem, a much bigger problem than vaping, smoking.
Great.
Hello, Carolyn, also from Australia. Just a question, just a question about youth vaping rates in New Zealand. So one of the many types of misinformation coming from Australia is that, the policymakers say we can't follow what New Zealand is doing because their youth vaping rates are so high. My understanding was that they used to be high and they were dropping down. Mm-hmm. So what's the situation with youth vaping in New Zealand?
I think there's a lack of understanding that when you have a new technology and combine that with the internet and young people research for themselves, and they're not necessarily going to listen to the principal and the teachers and the experts or the government. So they research themselves and they know that vaping, they've learned the truth anyway. So, but it was very attractive as a new technology, less harmful a drug, something to experiment with. And yes, a lot of young people did try it. They tried it. They experimented with it. I think it's very important that the statistics and the way that it's measured is done consistently. So you mentioned within the last 30 days. That doesn't mean that somebody vapes full time. And so there's a lot of manipulation of the information to mislead people. We have one group in New Zealand, Asthma Respiratory Foundation, and they have gone hard out copying PAVE, the American group, Parents Against Vaping, copying their materials. These groups share across the world. They share their materials. They say, here, use our materials and do what we did, and that's what's happening. And they formed lobby groups in New Zealand as well. So these there's been a lot of fear whipped up based on a lot of misinformation. However, vaping rates among young people are coming down. They've had a try, they've experimented with it, and it's coming down. So that's being ignored. What the big news is, our youth in New Zealand are already smoke-free. They're already below 5%. That's what the news should be. Why are they hiding that? Why are they not communicating that? Youth are already smoke-free. They're ahead of everybody else. They're ahead of the adults.
Thank you very much for your questions. clap. And thank you for bringing up Canada. I think Canada's a really interesting country to watch in this space. So thank you for bringing Canada up. Diego.
Okay, sorry for my English, but the question is, why believe yours that if it's so few doctors in Australia to register nicotine? Why is the reason? Yeah. It's not a bottleneck to accessibility? I don't know, but I like a colleague. Yeah. I don't understand that.
Yes, look, there's a number of issues. The doctors there have been a number of surveys, published peer-reviewed surveys of doctors in Australia, and the doctors are often sceptical about vaping. They're quite negative. The problem is that they're poorly educated and they believe what they read in the newspapers. They get very little, if any, training, and they're getting constant negative messaging from the Australian Medical Association, the Health Minister, the health charities, and they're just absorbing that narrative. And if you step outside that, of course, you risk being isolated and different. So they're kind of sticking with the groupthink and just absorbing the national narrative. And they're not doing the research, they're not reading the research papers, and they're not really keeping up to date.
Maybe if I could just chip in. The bad news is, as many of us have done studies, there's a gross misperception under physicians that nicotine causes cancer. Up to 40% of physicians today still believe that. And they are certainly, as Colin said, not trained into another form of quitting, which is switching to either oral nicotine pouches, vaping products, or heated tobacco. They're not trained that way. The good news is that if we were able to reach health professionals, and you know there aren't that many in the world, there are about 12 million physicians, about 15 million nurses, about 1 million pharmacists and 1 million dentists. If we can switch them, the principle will be FIFO, first in, first out. If you look at what happened in the United Kingdom, which was arguably the first country where tobacco harm reduction was first embraced by the government, it was because of the doctors. So at the time, Richard Doll did a study in 1952 on the link between smoking and lung cancer, and after that, most of the doctors in the UK stopped smoking. And once the doctors stopped smoking and they gave the right advice, there was a domino effect. Now, unfortunately, at global level and as at the Australian level, doctors haven't received the memo yet. But the good news is if we can get all of those health professionals, not just doctors, but all the health professionals to understand the benefits of harm reduction, we might have a changed world in a very short time.
I believe there's a question from over here.
Yes, from another part of the world, Latin America, it is very useful to hear you for one very simple reason. Our authorities, you know the story, Bloomberg, the WHO, etc. I'm not going to, it's known. But in conversations that we have had, for example, with medical doctors and controlled tobacco people, etc., we don't have in Mexico a figure like Chapman, a guru. No, our tobacco controllers are smaller. They do not have this hierarchy. But they say, no, what is necessary is to be more strict on applying the WHO, etc., the Empower and all these things. They say that. And because they are convinced, and I think they are sincere when they say it, even though I think they are wrong. But Australia is the best counterexample to that. Because we say, okay, which country? A country that it is fulfilling everything, is the superhero of the Empower, and look at the disaster. And look, even you can say, well, okay, smoking rates are decreasing, but they are stable. Compare this with Sweden and and etc. And so it is very important for us to get this information, and we will continue using this counterexample, these two counterexamples in our arguments.
Glad to be able to help.
Any comments on Roberto Sussman's question?
Thank you, Roberto, for that, and I hope it does help.
Yeah. Anders, do you have any comments for Roberto regarding the?
No. I think we are in for a long fight, because I mean the health authorities in Sweden and the World Health Organization and the European Union are all wrong. They're trying to outlaw all the alternatives to cigarette smoking, which I think is absolutely wrong. And again, I mean, if we were to do like use their methodology when it comes to intravenous drug abuse, for example, we would never save the people as we do today, never. So we have to be trust the people. I mean, people do understand that they'd rather not die, and if they can get the kicks somewhere, through some other means, it's better. And I'm happy to see that snus in Sweden and vaping in New Zealand and other measures are working together. So we can see that there is a growing tendency towards stopping of smoking.
Thank you, Anders. We have time for one more question.
If I could add one thing, I meant to say it during the introduction, and sorry, Nancy and Jan, that I didn't. But consumer groups are very important, have played a very important role in New Zealand as well, and Nancy will be talking later. We didn't have that for people who smoked. We didn't have smokers, well, there were smokers' rights groups, or, we'd never had people who smoke standing up for their rights, for better health care, for research on lung cancer. Don't just leave us to die. Do research on how to treat what's happening to us. Do research on cessation. We didn't get smoking cessation in New Zealand until 2000 because the policy analysts believed that it was not cost effective. They had very little faith in smoking cessation. Do research on smoking cessation then and figure out what will work and what will be faster. We didn't have that. People who smoked didn't have advocates, and watch out if you ever did try to advocate for anything for people who smoked, given the stigmatisation and the nasty things that are said about them. So consumer groups, both for snus, for vaping, we probably won't see that for heated tobacco products because they come from the tobacco industry, but very, very important and played a very important role in New Zealand as well.
Thank you. Time for one more question? No? Okay, great. Well, a big round, Bengt. One more?
30 seconds, Bengt Wiberg from Sweden. I'd like to emphasize what Delon said about nicotine in itself. And Sweden, I believe in Sweden, the normal people don't think that nicotine causes cancer. And not even the tobacco-free non-smoking generation, Tobaksfakta, etc., claim that nicotine in itself causes cancer. And today, look out in the world, everybody has access to smartphones, Google. And if you Google the question, does nicotine in itself cause cancer, you will get the answer, no, it doesn't. You get it from the FDA, from cancer societies. So my point is just to emphasize, start from the top. Don't go into details. When you talk to people who doesn't know, ask them the question, does nicotine cause cancer? And take it from there.
Thank you, Bengt. We'll close the first panel session now. So thank you very much. A big round of applause to our speakers.